facial anatomy and aging. When you're considering an assessment of the face, you have to consider all anatomical planes, which when we're looking at skull or skeletal resorption in terms of aging, we're looking at fat pads, we're looking at muscle, we're looking at vessels, and then we're looking at skin. So let's step back a little bit. In terms of the skull, as you age, the skull resorbs, bony resorption occurs. So think about it. If you look at your grandma or your grandfather when they're younger, they have these big eyes, and then when you take the pictures when they're older, they've got these tiny little beads as eyes, because the orbital rim goes from being rhomboid to being a tiny little circle all the way back in the skull. Then you've got temporal recession in the skull, so you have a hollow here. Then the zygoma, the cheekbone, can move forward or backwards. Then the mandible maxillary area, which is here, the jawline, can move forward or backwards. And then on top of that, you can have the nose growing in terms of cartilage, you can have the cartilage of the ears growing. So all of these things have to be considered in terms of bony aging. And you might even see that you might notice that some people have a forehead that's regressed or moved forward. So this is all bony aging. What sits on top of the bone is the fat pads and a lot of other anatomy. Now, fat pad migration, you've got the infraorbital fat pad, then you've got the malar fat pad, and you've got the buccal fat pads. These are the three ones that we consider in terms of facial aging. As you age, the fat pads move down and they slide down, and the buccal fat pad comes here. So what you're going to notice is you're going to have a hollow here, you're going to have a fold here, and you might get some jowling here. Then you have muscle aging. In terms of muscle aging, you'll notice that your wrinkles are starting to form in the frontalis muscle, in the forehead muscle up here, or your muscle can grow out, so you can have muscle hypertrophy, so your masseter muscles can get larger. Then you might notice that your muscles, your platysmal band over here, is more engaged, so you have to look at muscular aging as well. Then you can look at skin and skin aging, which we've spoken about before. In terms of skin, you've got cellular degradation, so the skin becomes deflated like a balloon. So if it's not as tight and taut, nothing underneath it will stay in the same position. So when you're assessing the face, you have to look at all anatomical layers before you can consider any type of non-surgical or surgical invasive procedure.